Hi, everybody. Thanks for joining a second chapter of our podcast. We're again here joining with Dr. Alejandro Freer. And, well, Doctor, it's a pleasure to join us in this second chapter. My name is Gustavo. I'm in charge of our concierge service in a Freer Dental Clinic. And, Doctor, well, I'm from firsthand experience receiving the leads and the requests and the questions that our potential patients have with us. And one of the major questions that I always receive is what type of procedures or full mouth packages they can expect to receive from our clinic.
All right. Well, first of all, uh, welcome to our podcast. Amazing second chapter, amazing topic. Look, many patients they ask, a full reconstruction. Basically, they say, I want to smile, but how to reach to that smile? That's the question. So we have been developed three amazing packages. One is a full mouth over teeth. Yeah. Another is there are some times that patients they have teeth that we need to extract and teeth that are missing, but many teeth that are in a good shape. So we developed a full mouth mix that will give you the option that you will have your final beautiful smile, making a combination of single unit dental implants and zirconia crowns. And the third package is a full reconstruction over implants that can finish always in zirconia. Okay? And basically, the idea of this podcast today is to talk specifically about that treatment. The famous full arches, that there's a whole topic about it. There's a lot of information, and we will love to guide to our potential patients to take the best decision for their new full dental implant treatment.
It's important that you mentioned that because, well, in our request from our potential patients, I received, I have a quote from an all-on-4, I have a quote for an all-on-8, I have a quote for a 3-on-6, but what are the differences that I can expect from all of these patients? And maybe you can explain a little bit of what are all these terms, why we offer an all-on-6, or what is an all-on-X? Perfect. All of these terms that I received from our potential patients, maybe you can explain a little bit.
Yeah, so let's talk a little about the history, Dental implants 25, 30 years ago, it was a very extensive and expensive treatment. Extensive in the way that in the past, first usually doctors, they extract teeth, make bone graft, give to the patient a removable denture, and tell to the patient, you need to wait 6 months, all right? So the bone graft can heal. Then of that, they put you the implants. But in those days, the technology of the implants, it was very difficult to make the implants to be inserted in the bone structure with a lot of stabilization. So immediate loading was a thing that was just doing in some universities and clinical cases, but it was not a real day life protocol. So it was 6 months of extractions, bone graft, putting the implants, 6 months of osseointegration, and then making the restorations. And 30, 40 years ago, without CAD/CAM systems, the fitting of the bars was a nightmare. It was a very complicated treatment. Then of that, like in the early 2000s, Dr. Paolo Malo, with Nobel Biocare, they developed the all-on-4. Basically, the all-on-4 was the first time that dentists were able to put not so many implants, avoid big bone graft like sinus lift in a way that they tilt the posterior implants, and were able to do immediate loading. Okay? So immediate loading start giving to the patients quality of life because you go, you have your surgery, and 1, 2, 3 days later, you have a temporary fix to the implants. Then of that, the all-on-4 for medical tourism is not like the treatment that I love the most because always in medical tourism, I will like to have a backup plan to my patients. For example, you come to our office. I put you on all-on-4, right? One of the implants fail because you smoke, because you have diabetes, or because you don't help us so much with the soft diet, or just because sometimes an implant can fail. If you come with 4 implants and 1 fail, no matter what, we need to make you again a surgery. That's why we develop in our office our all-on-X concept. this package that we give to our patients of full arch over implants, basically what you're going to pay, it will be included the bone graft and as much implants as your bone can have. Having, of course, top 6, 7 implants, okay? Sometimes 8 implants. But the benefit of this is that if 1 or 2 implants are failing, when you come back for your second stage, still we can continue giving you your final prosthesis without any more surgery. And in most of the cases, when the patient doesn't have any kind of failure of the implants, we are able to have a lot of options for the final zirconia restoration. That's something that I wanna talk in this chapter, because there is so much marketing about full arch that patients need to understand that the goal is to reach to your final zirconia restoration over implants. There are many techniques to give to the patient that, but not every single technique is for every single patient, okay?
Correct. No, that's interesting that you mentioned that, because one of the other questions that I most currently I see from our patients is like, what are the requirements or what type of green light do I need from my primary doctor to have this type of procedure? For example, I know that there is some type of problem with people with diabetics, but I don't know what type of requirements do we need from our patients that are considering this type of full mouth transformation in their mouths.
Right. So basically what I need is that the patients, they need to be stable. Okay, for example, you can have diabetes, but if you have it under control, you're a candidate for implants. All right. Okay. Basically, there is anything that will give you a 100% contradiction to having dental implants. Okay. But there are things that can affect. Talking with the statistics, if you smoke, if you have a long history of smoking, we can say that usually in a healthy person, a dental implant will have 98, 99 success rate. But if you smoke, it can drop down to around 85%. If you have diabetes on control, I will not recommend to have the surgery, because you can have 35, 40% of chances of implants failing. But if you have diabetes and you are under control, maybe you can have a little more chances of an implant failing, but that's why we try always to put you 1 or 2 extra implants so we can have a backup plan, all right? Okay. And we have a lot of techniques to try to help and to improve the chances of that implant healing in your bone structure.
One of the things that is very important for our potential patients is the experience that a clinic can offer for this type of procedures. Mm-hmm. So maybe we can explain a little bit of what is the current average that we are having for full mouth transformations in our clinic, how many implants do our surgeons are putting per year. That talks a little bit about the experience and why you're choosing a company that will give you the same or even better quality than in the United States.
That's super important. You know, experience in these treatments is a key factor to have success. We are an office that we have been working on this for the last 15 years. And nowadays, we have the blessing that we can receive from 6 to 10 patients a week that they're coming for a full mouth over dental implants restoration. So we put thousands of implants in a year on international patients. And this experience has led us to our best full arch implants protocol that we have been developed. That is our All-on-X for dental process, that we have different things and different technologies and different clinical decisions that we use to try to increase as much as possible the success in all of our patients. So if you want, we can discuss a little of that later. I can show you cases and I can show you things that separate us from other clinics in some clinical details that we decide to help the patients have a better experience.
That's a good time to pivot into my next question. is because one of the things that is very good for our potential patients to understand firsthand from your doctor is what can they expect from the procedure day by day. I mean, we're going to start on Monday with the consultation, and maybe you can show us a little bit of what it was before, what can they expect day by day, and some results from our previous patients.
Yeah, of course. All right, so basically, the first thing that I'm going to tell so the patients can understand is who is a candidate for a full arch restoration. And basically, this X-ray will help us a lot because I will put it in this way. Most of the patients that come to our practice, they have or a terminal dentition, that a terminal dentition is like this patient in the top maxilla. You know, you have 3, 4, 5, 6 remaining teeth that are in a very bad shape, and it's better to take them out and start from zero. Or there are other patients that they come already without any set of teeth, like this patient in the bottom. So, depending on your bone structures, we're gonna decide to put you 4, 5, 6, or 8 implants, okay? How many implants? Depending if the patient has bone in the back maxilla, the thickness of the bone structure, the density of the bone, all those factors will affect. But our promise in our office is that you will have the most amount of implants that your bone can resist at the same price, okay? So the first day you will arrive, they will take you to the office, we're gonna take you CT scan, we're gonna make you a digital scanning, and you will have a consultation personally with me, all right? We're gonna determine which is gonna be the best dental implant package for you. And then of that, you're gonna go and have the implant placement of the dental implants, all right? That surgery will be done under sedation and will be performed with one of our surgeons, all right? In the moment that we finish the surgery, the first decision that we need to take is how much stable is that implant in your bone structure, okay? That is super important. In medical tourism patients, we need to go step by step, being 100% predictable. So remember that in a week from now, those patients are gonna be thousands of miles away from us. Right. So I need to ensure to those patients that the idea is to have 20 years of success, and I will never compromise the comfort, and I will never compromise the success of that treatment by 3 or 4 months of comfort. So 95, 96% of our patients, they will have what we call an immediate loading. That means that we put the implants, and immediately we're gonna be able to take an impression of those implants. Why? Because the implants are already stable in the bone structure, okay? Then of that, the concierge service of the office will take the patient back to the hotel, to the apartment, and the patient will rest. Meanwhile, the patient is resting, our dental lab will design this metal bar frame. This is one of the things that separate us from many clinics. Most of the clinics, or nowadays with the technology, the temporaries that they design is with a 3D printed resin, okay? We also do it, but to all of our temporaries, we add a metal structure or a fiber resin structure. Why? Because this will ensure to the patient that your temporary will not break in two and you will not have a catastrophic fracture that will affect you and will make you come back again to Costa Rica. Mm-hmm. This treatment, having a temporary with a metal bar structure, in many clinics in the world is like having a final restoration. But in our office, it's just your temporary. The metal bar frame will help the implants to have a better osseointegration because it will reduce the micro movement of the implants in the bone structure, and the most important, will protect the patient of having a catastrophic fracture, okay? Then of that, the patient will come and we're gonna make an aesthetic trying, okay? That aesthetic trying, the patient will see their teeth and he will be able to choose the color, see the shape, see the smile. And when the patient is already happy with the procedure, we are able to pass a patient from this to this. And in the past, most of our temporaries, this is the classic all-on-6 or all-on-4. You know, Inside this structure, you have the metal bar frame, and the set of teeth are from acrylic. Sometimes, to the patients, you need to make a temporary that is full resin. But in my medical tourism patients, I never do this. Why? Because this material can break, and I will never put one of our patients in that risk. So nowadays, with this technology, photogrammetry, that is one of the things that we have in our office, that is super important. Look, when you have many patients in a week and you have many doctors working, you need technology that can ensure you that everyone will have the same precision. You can be a doctor of a lot of experience, and I can be a doctor that I'm also a specialist, but I don't have so much experience as you. And the human factor of taking impressions post-surgery can affect the process. Photogrammetry is a scanner that will take in real time, the position of the implants. Okay? Taking the position of the implants with this scanner will help us that every single case, the fit will be perfect. And we are one of the 2 or 3 clinics in Latin America to have by us only for our clinic one of these iCam photogrammetry technology. Okay? So with this technology, now we are able to give to our patients our temporaries, no pink with the metal structure. So it's more comfortable, it's closer to having a natural teeth, and you will have the strength of the metal substructure preventing any catastrophic fracture.
And I think it is important for our patients to know that this guarantees that they will receive a totally 100% personalized prosthesis for each case. This is not that we build a custom prosthesis for all of our patients. We build a total 100% personalized depending on the geometry of each case and each mouth.
That's really true. Look, one of the things that we try to do in our office is that you're not a number, you're a name, okay? So clinics that they tell you, oh no, all the patients are all on 4, or you just need an all on 6, you just need an all on 6, or you just need a 3 on 6. Not every single patient needs the same treatment. Like I just told you, the goal is to give to the patients a new set of teeth of zirconia over dental implants. Okay, so for example, if you're a patient that you don't have so much bone, we're gonna put you 4 implants, we're gonna make you an immediate loading, and we're gonna give you your final full arch, full zirconia. And yeah, maybe if you have an all-on-4, you will have a lot of bone loss, and we need to give you pink material because we need to give you support to your lips to help you have a better aesthetic. But if you're a patient that you have a terminal dentition and you have more bone structure in your back maxilla, possibly we're gonna put you 6, 7 implants. And that means that when you come for your final restoration, maybe we're gonna be able to do it in separate little bridges like a 3 on 6 that will be as close as possible to a natural restoration, a natural teeth. But also nowadays with photogrammetry, we can make you a very thin bridge with a superstructure of metal that can give you the same comfort as a 3 on 6, but with the benefit that maybe we can do that with 4 or 5 implants, okay, in one full arch. So that's why in every single case we make a personalized treatment plan, and we talk to the patient to actually reach the best dental option for that patient.
Okay. Well, Doctor, and one other thing that is always important in my communication with potential patients, they want to know that after choosing our clinic, and they want to be comfortable and assured of what type of service they can expect after they have done the processes, what type of written warranty they can expect from us. So that is important, and maybe you can showcase.
That is super important, warranties. Look, we will never be that clinic that will tell you lifetime warranty. For me, that is a scam. Okay, nothing is for lifetime, I always tell this example to the patients. You can buy a Ferrari, but if you never change the oil, that the car will break. It's exactly dental implants. We put you the best dental implant that there is in dentistry, novel biocare, okay? But if you don't make cleanings, the implants also will fail because dental implants maybe they will not have cavities, but they can have bone loss. And if they start having bone loss, the implants will fail. So the way that we give to our patients the warranty is every single year that you make a cleaning and you show to us that you had a professional cleaning, for that year you will have full warranty, okay? And for the restorations, you have a 5 years warranty. So that's a way that, we share responsibilities. It's not always doctor's fault. Sometimes the patients feel that they have implants and that they will forget about dentists for their whole life, and that's not the case. You need to take care of them. You need to clean them. You need to have some precautions of what you can or not eat. Okay, and that's how we do it. One of the things that I try to ensure to my patients is something that is very important. Doctor, now that I'm going back to the States, will the doctor know about my implants? Mm-hmm. We ensure to our patients that having novel biocare in their mouth, every single doctor that knows about dental implants will understand their system and will know that they have the best dental implant system in their case. And then of that, we guarantee you zirconia from Zirconsam. That is one of the best products of zirconia that in dentistry we can offer to the patients. So having those details will help to the patient that every single doctor will know what to do in their case.
Okay, doctor, well, I really appreciate this time that you gave us today to explain a little bit of what our patients can expect from our clinic, what type of procedures they can expect. And I really invite everyone to join us in our next chapter to keep hearing more about services and get to know a little bit more in this experience in the full mouth dental procedures.
Perfect. It will be a pleasure. And remember, there are many options. Not every single patient needs the same treatment. And we have all the options to try to help you to change your life with a new smile here in Fair Dental. It was a pleasure. Bye, Gustavo.
We'll talk soon.